One of the awful truths that has come evident during this pandemic is how weak our medical system is. Dr. Shawn Whatley is the author of a book, When Politics Comes Before Patients. He joins me right now because people are realizing, not only with long-term care, but we have politicians saying, well, we have to lock down because if something really terrible happens, we don't have the hospital capacity. I mean, have we been ignoring our system?
We totally have. For the last 20 years, we've known this. So in Canada, we have 2.5 acute care hospital beds per 1,000 population.
What should it be?
Europe, they have 4.7. Germany, on average. In Germany, 8. Japan, well over 10. So even if we take the average in Europe, 4.7, we're far below. In Ontario, we only have 1.5. Every single winter, we want to cancel surgeries and we have hallway medicine because of influenza. And now we get to blame COVID.
And yet we spend a lot of money on the health system.
$264 billion a year. And the strange thing about the COVID crisis, Doug Ford added 3,100 beds to our system last year. The peak of admitted hospital patients from COVID in wave 2, 1,600. So if we had all these new beds in one COVID hospital, it would be less than half full.
So what's the problem? Why are we having lockdowns if there is a capacity there?
I want to ask you the same question. So the issue is not there is capacity. The issue is that we're so close to the wire, even without COVID, that even a tiny blip makes everyone panic. But if it truly is a capacity problem, government's had a year to solve that. And there are many ways to do that. Hospital, patient hotels, you can have field hospitals, many ways to add capacity. If capacity is the excuse, then it should already be fixed.
And we have seen countries around the world, not just China, but other countries, building hospitals for COVID patients.
Absolutely, if it is a capacity problem.
Right.
But it bothers me that we run into the same argument every single winter for the last 10, 15 years, as long as I've been in medicine, over 20 years now.
So is it the fact that our governments are just not being straightforward with people, or is it the fact that people are saying, well, times are good now, so we don't want to raise taxes and pay for more?
Only 4% of us ever need to get admitted to an acute care hospital in any given year. 96% of us live on the myth that we will get care when we're sick enough. And so if we really want to increase capacity to a European level, it's going to cost a heck of a lot more money, and that's a whole nother political problem to solve.
So really, though, I mean, it's time for Canadians to get to it and have a real discussion with people elected.
Well, I think we've had this for 50 years now. Maybe we should stop and say, is it delivering on the dreams that we had for it? Or does it leave patients without care, and too often the care that they get is undignified? That's where we need to start the conversation.
And you just did. Dr. Shawn Whatley, thank you very much. There's a book, When Politics Comes Before Patients. 3 minutes. Thank you for watching. We need more subscribers, so please press a button if you haven't already done so, and suggest to your friends that they press a button as well. And you'll also see there is a new factor there. It's called PayPal. It is working, it is direct, and it certainly helps us cover the expenses to keep this show on the road. So, 3 buttons: subscribe, PayPal. Thanks very much.